hyperbilirubinemia or hemolysis when unconjugated hyperbilirubinemia combined with calcium. Pigmented لأن either dark brown or black in color. مو مثل الكوليسترول ستون. الكوليسترول هذه شكلها yellowish discoloration due to excess cholesterol content. Okay, and you identify here the laceration and mucosal ulceration, fibrosis, and thinning of the wall. Okay. Any question, شباب؟ اسألوا, don't hesitate, please.
دكتورة ممكن يصير عندنا بنفس الوقت بيجمنتد ستون وكوليسترول ستون؟
انا ما شايفه الحقيقه هيك صوره. هاي صوره اول يوم شفتها يعني فخليتها يعني ميكست. انت اخذها في الكوليسترول ستونز are risk factors ذكرناها. قلنا female fatty كلها related to increase level of estrogen, female fatty fertile, بعد شنو hyper يعني hyperlipidemia, in addition to increase weight or rapid weight loss. هذه اللي هي risk factors. Fertile female, any cause that is associated with the increase in cholesterol concentration in bile. any cause, أي سبب يزيد الكوليسترول in bile, whatever the cause, congenital hyperbilirubinemia, أكو congenital hyperlipidemia مثلا, patient with excess cholesterol in the blood, they develop this complication because of no more salt. لأن الكوليسترول شو يحتاج حتى to be metabolized, يحتاج إلى to bind with bile salts. No more bile salts to combine, so excess cholesterol will be precipitated as a stone in bile. Okay. This is one mechanism. The other mechanism أنا أعتقد إنه هذه هي كانت كلها pigmented cholesterol stone, and there is super added bacterial infection and colonization in the biliary passages due to obstruction of the biliary passages by a stone, lodged stone or impacted stone, and there is formation of this dark brown color pigmented stone on a background or in addition to cholesterol stone hypercholesterolemia. There is another risk for formation. احنا قلنا risk for formation of pigmented stone هي شنو شباب؟ مو أهم تو risk، مو صحيح؟ مو تذكرون؟
دكتورة unconjugated bilirubin.
Unconjugated hyperbilirubinemia from excessive extravascular hemolysis. hemolytic anemia، واحد عنده hemolytic anemia، عنده thalassemia، any autoimmune hemolytic anemia، any cause. زين؟ وياها another cause غير الهيموليتيك انيميا. هذول الهيموليتيك انيميا شباب ما يصير عندهم، قلنا نو انفكشن، ما يصير عندهم انفكشن. الكوز مالتهم مو انفكشن، الكوز is excess bilirubin, excess unconjugated bilirubin. Okay, here there is super other cause. يلا الكوز الاخر هو شنو for pigmented stone؟ قال زميلكم hemolysis. نعم. Yes, biliary tract infection, biliary tract stasis. أهم شيء الستاسيس. stasis يعني شنو؟ whenever there is stasis there is obstruction. من يصير obstruction شو يصير؟ يصير colonization of bacteria, ascending of enteric bacteria and colonization into the biliary tree and formation of this type of pigmented stone. So the other risk factor is formation of pigmented stone is the biliary tract infection. Biliary tract infection, bacteria in the biliary tract can result in this type of. زين، يعني هذا الكوز مالته مو شو اسمه، مو hemolysis. زين واضح. It is started as cholesterol stone for suppose that, and superimposed by secondary biliary tract infection and formation of this pigmented stone as a result of biliary tract ascending infection. هذه هي اللي نسميها البلاك colored. The stones that are formed from biliary tract infection are dark brown. So dark brown. واللي stones that are, or pigmented stones formed from hemolytic anemia, they are associated with no infection usually, and they are black in color, مو dark brown. واضح؟ Okay. Any question, please? اسألوا يلا, come on. Gallbladder cancer. Gallbladder cancer. This is one of the gastrointestinal tract cancers. It is uncommon malignancy. However, unfortunately, it is highly fatal because of vague symptoms, because of late diagnosis, and it is can be or most frequently seen in the cancer in the biliary tract. It is a cancer of ominous prognosis and high fatality due to late diagnosis. The symptoms can mimic chronic cholecystitis, can mimic abdominal pain, and they are vague, and also in addition to general features of cancer that are comes late, like anorexia, weight loss, cachexia, and so on. Arise from the fundus, usually most of them within the fundus, and may obstruct the bile flow at the common duct, obstruct the bile flow and also can be presented acutely at this state, or can be presented شباب هنا تعتقدون when this type of cancer obstruct the bile flow at the common bile duct and the duodenum. What's the typical presentation? The common presentation here, which is late. What is the common symptom seen here in obstruction of the common bile duct by this gallbladder cancer? Any idea? Jaundice is the patient can be presented with jaundice at this stage when there is obstruction of bile flow, unconjugated hyperbilirubinemia. Okay. Risk factors for gallbladder cancer. Chronic gallbladder inflammation. شباب هذا شنو يذكركم؟ Chronic gallbladder inflammation is a risk factor for gallbladder cancer. What we call it previously. ما مر عليكم هاي البروسس؟
دكتورة كالكولاس؟
لا مو كالكولاس، لا. chronic inflammation followed by cancer. هاي شو نسميها؟ وين مرت عليكم؟ تذكرون أخذنا فد آخر subject بالgastrointestinal tract ورا ulcerative colitis أو after colorectal cancer سميناه colitis associated neoplasia. قلنا عليها ايش حكينا عليها؟ قلنا it indicate or it point to the importance or the role of chronic ongoing long-standing inflammation on the start and evolution of cancer. Then, long-standing ulcerative colitis can be progressed to colorectal cancer. Long-standing acute chronic atrophic gastritis with H. pylori can progress to gastric cancer, diffuse type, intestinal type, sorry. بعد شنو فد شيء آخر. What about malabsorption? تتذكرون back to malabsorption, back to celiac disease. شنو سميناها؟ cancer arising in celiac disease.
ليمفوما.
اي ليمفوما يا ليمفوما. شنو سميناها؟ شنو إلها اسم؟ سميناها enteropathy associated T cell lymphoma. ليش؟ قلنا after 15 to 20 years of long-standing sensitization and of these T lymphocytes, T cell lymphoma اللي هي قلنا عليها of bad prognosis can evolve in patient with celiac disease. Okay? هنا نفس الشيء. Risk factor for gallbladder cancer is chronic gallbladder inflammation, chronic cholecystitis. Okay? يعني انتم عقلوها هيك اخذوها بالعقل، يعني normal gallbladder and an atrophic ulcerated مثل هذه. يعني شوفوا هذه الجallbladder، هذه شو تقولون عليها؟ هذه نسميها احنا الكرونيك calculus cholecystitis. You can see ulceration, mucosal bleeding, a sloughing of the mucosa, thinning of the wall، مثل thinning of the wall of ulcerative colitis. نفس البروسيس، يعني long-standing ongoing inflammatory process, damage to the mucosa. So atypical cells or dysplastic changes can arise from which a focus of cancer can evolve. زين، فهذه البروسيس هي مو بس هنا، مو not only here. زين، راح تاخذون هسه بال long standing smoking او chronic smoker. It will be associated with squamous metaplasia of columnar epithelium of the bronchial tree or of the trachea, and subsequent dysplastic changes and bronchogenic carcinoma and so on. بالurinary bladder نفس الشيء، بالهارزياسيس chronic cystitis اللي هي bladder urinary bladder نفس الشيء، urinary or transitional cell carcinoma arising on a background of chronic cystitis and so on. واضح؟ So chronic gallbladder inflammation, long-standing attacks and episodes of inflammation, ulceration, damage, trauma to the mucosa by irritating gallstones, especially the gallstones, cholelithiasis. هذه PSC معناها primary sclerosing cholangitis. primary، خاف تشوفوا هاي الاختصارات، يعني مرات نختصر primary sclerosing cholangitis. هذه وين شفتوها شباب سابقا؟ اختصرناها لأن مذكورة سابقا. Who can remember? It is associated or seen. It is an autoimmune process. وقلنا autoimmune diseases comes in clusters. It is coexist with another autoimmune disease اللي هو ulcerative colitis. Okay, chronic infection of the biliary passages. All of these are associated with repeated attacks or repeated bouts of inflammation. Cholelithiasis, gallstones, primary sclerosing cholangitis, autoimmune damage to the intrahepatic biliary passages and extrahepatic biliary passages, and also chronic infection, chronic biliary infection due to stricture, due to stone, and so on. Female with increase in level of estrogen and associated other risk factors. Cigarette smoking and the toxins and toxic metabolite of tobacco are also risk factors, carrying many carcinogens. Occupational carcinogens هذول اللي يعني يشتغلون بالريفاينري، المصافي، البيبر industries and so on. They are exposed to many carcinogens during their work. And genetic predisposition is an important factor for all cancers, not only gallbladder cancer. This is the microscopy, Shabab. This is the microscopy of gallbladder cancer. What is the type of this cancer, please? What is the type? Shabab, them too. What is the type of this cancer, please? The type. What is the type? Is it? Did you see this type before? شو راح تمتحنون؟ بس أريد أعرف شلون راح تمتحنون؟
ترى أدينوكارسينوما.
أدينوكارسينوما. احكي ابني، احكي أنت وغيرك، احكوا don't hesitate. أدينوكارسينوما malignant glands. يلا شنو بيها هذه المالجنانت glands؟ شو تشوف بيها؟ are these cells well oriented, well polarized, شلون نشوفوها؟ normally هي columnar مو صحيح؟ basally located nuclei. هنا صاير بيها؟ صاير بيها هنا؟ changes. يلا الحكاية النشيدة مالتنا.
hyperplasia.
Hyperplasia, adenocarcinoma, hyperplasia. لا, hyperplasia is a benign condition. أي. Yes.
hyperchromasia.
pleomorphic change.
اكو يعني بالشكل شو اسمه الشكل مختلف. النيوكليوس يعني متغير مكانها، يعني مثل distortion يعني نقدر نقول.
Pleomorphism.
نعم.
واحد من الشباب قال pleomorphism. Pleomorphism, hyperchromasia, loss of polarity, loss of orientation. بعد high NC ratio. بعد ولا سيل تشبه الأخرى، هاي نسميها pleomorphism. high NC ratio, high large nuclei, prominent nucleoli. بعد شوفوا هالفيتشرز. frequent mitosis can be seen. Changes of malignancy in these cells. So malignant glands form. So most of the tumors are moderately differentiated adenocarcinoma. The laboratory finding or laboratory tests. There are certain tumor markers. هذه الtumor markers سامعين بيها شباب؟ سامعين بيها هذه؟ carcinoembryonic antigen. هذا وين يصير positive بعد؟ يصير positive بالcolorectal cancer. أيضا carcinoembryonic antigen CA19-9 positive بالpancreatic and in gallbladder cancer. Liver function test can indicate features of cholestasis and biliary obstruction, like elevation of serum transaminases and membrane enzymes, and also elevated bilirubin. Total bilirubin is elevated. اوكي لحد الآن اكو شيء سؤال على الجول بلادر شباب؟ Pancreatic pathology, okay? Yes, the pancreas. What about the pancreas, شباب? What are the constituent or the histological constituent of pancreas? Anyone can answer me. شباب, what are the constituent of هذا histology يلا. What are the constituent of the pancreas? Is composed of what is the function? شباب.
دكتورة
endocrine
function
portion
of
with exocrine portion.
اي صحيح. كمل ابني انت شنو تريد تقول؟
function of pancreas,
اي
secretion of many enzymes
اي
which help in the digestion of carbohydrate and protein and lipid.
يس زين. اي قالت زميلتكم exocrine and endocrine part. What are the proportion, normal proportion of exocrine to endocrine part? منو أكثر؟
الإكسوكراين يكون أكثر.
Yes, exocrine part is more. تقريبا 85 to 90% is the exocrine pancreas secreting digestive enzymes to be secreted into the main pancreatic duct to be collected in and help in food digestion. والendocrine part اللي هو composed of شنو؟ Langerhans giant, islets of Langerhans that are secreting شنو؟ insulin and glucagon B alpha and beta cells. زين. Regarding the pancreatic pathology, we will discuss today acute pancreatitis, chronic pancreatitis, pancreatic pseudocyst, and pancreatic cancer. Acute pancreatitis is من اسمه acute pancreatitis. There is sudden, severe, reversible inflammation due to autodigestion. And the types can be mild and can be severe, according to the insult, according to the severity of the causative agent. The mild can be associated with inflammation and only parenchymal edema without necrosis, fat necrosis and surrounding fatty necrosis, whereas the severe type is associated with more parenchymal or acinar necrosis and hemorrhagic pancreatitis, and نسميه acute necrotizing hemorrhagic pancreatitis. The pancreatic enzymes like amylase and lipases are prominently elevated. They are elevated or peaked in the there is elevation of these digestive enzymes, amylase and lipases in the serum and in urine. This is important diagnostic serology for acute pancreatitis. Serum amylase and lipase. The release of pancreatic lipase. This is an enzyme for fat digestion. Lipase causing fat necrosis. In the pancreas and around the pancreas. So pancreatitis can be seen on X-ray as chalky spots or when these foci of fat necrosis combined with calcium to form calcium or fatty necrosis seen on X-ray. Sometimes can be misdiagnosed as metastatic cancer. Damage to the blood vessel, it is related to protease enzymes, that are digest the wall of blood vessels within the pancreatic parenchyma, causing acute hemorrhagic pancreatitis. The main causes for acute pancreatitis are gallstones, cholelithiasis, alcoholism, direct trauma, whether surgery or other type of trauma, external trauma, infection, viral infection or bacterial infection, or even idiopathic or hyperlipidemia can be associated with acute pancreatitis, or certain drugs that are interfere with the enzymatic metabolism or synthesis of the pancreas, exocrine pancreas. This is a diagram. Shabab showed you the normal, or showing you the mechanism of formation of acute pancreatitis, how it is formed, what are the causes. These are the pancreatic acini. And they are exposed to, and the mechanism of pancreatic injury in acute caused by direct acinar injury, that is caused by alcohol, which is causing direct acinar injury, or from its toxic metabolites, and also generation of free radical reaction by alcohol. Viruses, certain viruses can infect the pancreatic acinar cells. Certain drugs and trauma, hypercalcemia and hyperlipidemia, these are causes of direct acinar cell injury. When there is acinar cell injury, there will be damage to the cells, there will be release of digestive enzymes, amylase, lipase, protease, and the amylase will be prominently seen or elevated in the serum, and is important serological diagnosis in patients suspected acute pancreatitis. Proteases are important or causing digestion of the wall of the blood vessels within the pancreatic parenchyma, and extravasation of blood into the pancreatic parenchyma result in acute hemorrhagic pancreatitis. And lipases causing fat necrosis, digest fat within the pancreatic parenchyma and in the peripancreatic tissue. So fat necrosis, hemorrhagic necrosis of the blood vessel destruction, and are features of acute pancreatitis, with the elevation of serum amylase and lipases. The main cause is also not only قلنا الأول شيء الأسينر or direct acinar cell injury. It can be also caused or mainly caused by obstruction of the main pancreatic duct. Obstruction of the main pancreatic duct is made up by lodged or impacted gallstone. تجي من الcommon bile duct to be lodged into the main pancreatic duct, which is the main collecting or excretory duct of the pancreas, of the exocrine pancreas. This obstruction is associated with